We're also joined by the president and CEO of Medicor Cancer Centers, Dr. Humaira Khan. And Dr. Khan, do you think that the endorsement of Dr. Day as the national representative for this country's 62,000 doctors may leave many Canadians wondering if doctors have their best interests in mind?
I think it should actually be a very positive step, and people should feel really happy with the way things have turned out, because what it shows is that people are not happy with status quo. I think we need to move away from the debate of who is a supplier of health care, whether it's private, whether it's public, and look at providing care to people who need them when they need them so they don't have to suffer. So this just signals that we're not happy with the way things are going. We don't want to be on the wait list. We don't necessarily want to give up our public system. We just want to be ensured that we do get the care that we want, and this just means that we need to look at other ways to provide health care to people who need them.
But if we do that, would that not mean that we could possibly forget that some people can't afford private health care?
Well, I think, again, that goes into the debate of public and private. And as Dr. Day has said time and time again, that he's not saying that privatization is the answer. There needs to be a blend. There are already so many things which are blended in the system, which people don't see just because everyone talks about the public and private. If a sick patient needs to call an ambulance to go to the hospital, they have to pay a $45 copay. Well, I wouldn't call that public. So I wouldn't call that just a public system. People pay for drugs. People pay for private rooms in hospitals. And if we need to have a system where a patient is put on a wait list because they have cancer, well, go ahead and tell the cancer that you have to wait, because the public system tells you that this is what's acceptable in their country.
Okay. I think that we've made it clear then that the message for those people who are in fact advocating for privatization of the public health system is that they want to obscure the fact that they're pushing for the privatization of the health system by pointing to privatization that already exists in the public health system. But the fact that you have to pay for your ambulance, which is a hardship for many people and which we too oppose, does not actually support the idea of paying for surgery out of pocket, which many people can't afford. And in fact, when you take the doctors out of the public health system for those people to provide services for those people who can afford to pay to jump the queue, then you actually deprive the public health system of those doctors. If wait lists are a problem of demand and supply, in that there is more demand than there is supply, that supply is of scarce doctors and health professionals and their equipment. And moving those things out of the public system
but
actually will make the public health system worse.
Leaving the public
ladies,
system.
hang on one at a time here now. Okay.
Dr. Khan.
Go ahead,
I totally agree with Natalie that there are scarce resources. Not only are there scarce resources because there are more and more treatments, more and more tests that are coming up, which obviously the public system can't support, plus the fact that the doctors are leaving the system because they're not happy with the way the public system is run. The retention of doctors in our system is so little that most of them are crossing the border. The patients who need their health care go across the border. So I think by providing the patient the option of having the treatments in their own country would be a great bonus.
Okay, Natalie, I have to ask you, do you think that this election is going to mean that the government will take it as a sign that they can begin to promote a parallel system?
I think it sets the tone. Dr. Day's been a very aggressive campaigner for the expansion of for-profit business for healthcare, and so I think that will bolster for sure the business forces that are pushing for privatization and Americanization of the Canadian health system. The extent to which the government responds, well, the Harper government nationally has to contend with an election coming around the corner, but it is of concern when forces that oppose the public health system start to coalesce like this and move out on a more a more aggressive campaign to promote their interests.
Dr. Khan, I want to ask you about a for-profit healthcare system in other countries, and it is obviously successful in other countries, but how did it come to fruition? Were these countries that had problems with the public healthcare system and situations such as this where they aggressively campaigned to have a parallel system for healthcare in their countries?
Well, there are different countries that are doing different things. For example, a lot of the European countries have both public and private system, which does cut down the wait list. So I can't go into the history of every single country,
right.
But I think there's a point when you have a perfect system like the public health system, and I do have to correct what Natalie said, that we're not opponents of the public system. I think it's the greatest system as long as it works. And if it doesn't work, you have to look at injecting fresh blood into the system and coming up with alternatives, not necessarily to say we're just going to go with the public system or just going to go with the private system. There can always be a way in which both systems can coexist and work to provide the health care that the people need.